Welcome to the Health Zone. My name is Dr. Toju Chikiobi, but everybody calls me Dr. Toju. We have a wonderful show lined up for you today. We will be talking about mother, newborn, and child health. And you know what? That's a very, very important topic because 162,000 women die every year in sub-Saharan Africa for problems related to pregnancy and childbirth. And we lose 1 million babies in their first 28 days of life. It's a very, very important topic. And we have two amazing guests with us today who will help us figure out the things you and I can do to prevent the risk of death in pregnancy and childbirth, and to make sure that our little babies, our little wonderful ones, survive through and beyond their 5th year of life. Please don't go away. Welcome to the Health Zone. We have a fabulous episode today. We're going to be talking about mother, newborn, and child health. I'm going to keep it simple. And we have terrific guests with us here today. We have Dr. Orade Dorothy, who is coming back to us after a passion. She did World Malaria Day event with us, and it was great working with her. But Dr. Orade is with us here today, and we're really pleased to have her. She's a board-certified pediatrician and a public health physician. She's the country director for an international nonprofit agency called AfriCare. They're very involved in communities that are supportive of the development of women, children, and babies. They help create livelihoods for members of the community and help with just improving their health literacy and just the basic health of all members of the community. So it's really wonderful having her here on the show with us today. Dr. Orade, welcome to the Health Zone.
Thank you for having me. It's nice to be here.
It's so good to have you here. I'm looking forward to our discussion. Our second guest is Dr. Chita Wan, and she is a returnee, old hand. She's been on the show a few times for us, and so we're really pleased to see her back with us here today. Dr. Chita Wana is a board-certified obstetrician gynecologist and the medical director of Tabitha Medical Center in Abuja. She is also the chairperson for the Guild of Medical Directors, the Abuja chapter. She really has a passion for community outreach and anything that has to do with women's health. She's very, very passionate about. And so we're really honored to have her here with us in the studio again. Dr. Chito, welcome to the Health Zone.
Thank you for having me.
It's good to have you back.
Thank you.
So, as is our usual custom here on the Health Zone, we're going to go out to find out what the man and woman on the street know about mother, newborn, and child care. And I know they have so much to tell us about because we know we have major problems in those areas in this country. So don't go away. Stay with us. Let's watch the video together.
Today we'll be talking to the man in the street. Why do you think that women have complications during childbirth?
I think lack of care, I guess, like appropriate health care, I guess. Negligence, medication, drug abuse, alcohol.
Okay, have you or anybody that you know experienced complications during childbirth?
Yes. Family members and, friends.
Okay.
Yeah.
And how was it for them? What was the experience like for them?
She waited till it was really, really complicated for her to get medical attention, and by then it was too late. We've had situations where the baby wasn't in the right position. Baby was breached, or the baby didn't come out at the particular time the baby was supposed to come out, like the EOD.
Do you think there's a difference between formula and breast milk?
Of course there is.
Okay, what's the difference?
I don't know, but I think there is. There's some nutrient there. I think there are certain nutrients you can find only the mother can only produce that you can't synthesize.
So I'm going to start with you, Dr. Chito. How can we ensure that women survive and remain healthy during pregnancy and the process of childbirth?
Like you said before, the maternal mortality rate globally has gone down, but still we have pitiful numbers in sub-Saharan Africa. And the major issue then was access to healthcare. And as access has improved for some places, it's still limited for many. And that gives rise to deliveries by workers or health workers that are not skilled to do that job. One of the things that really concern me in these areas where they lack access to health facilities is that you have traditional birth attendants and skilled and community health workers that cannot recognize when there's trouble, when there's complications that need them, that at that time they would have referred the patient to a more tertiary center, and that's why most women die. But just to go back to your question about what we could do, number one, health education. So when we go out for these outreach, it's not about just providing the care that we think they don't have, but it's about educating not only the health worker or the TB or traditional birth attendant, but also educating the women themselves on what to do, what they will feel if they're having like high blood pressures, or what bleeding means in pregnancy, and also about simple things like nutrition. These are difficult times, so we're expecting even more issues where it concerns nutrition, and we know that something like malnutrition is very, very significant where it comes to a healthy pregnancy. Because if you're malnourished, you are high risk for preterm delivery, and you can imagine that happening in that kind of area. You definitely know that the baby may not make it, and you're also at risk for low birth weight and also birth defects, which again, if defects are noted in that area, babies sometimes may not survive it. Antenatal classes, we know in the urban hospitals or the more skilled facilities has really shown to reduce complications in pregnancy. So we know that this is something that we promote in the rural areas. It will definitely affect or reduce how much maternal mortality we see in those areas. Another thing is antenatal care. Now, again, it comes down again to assessing the facilities to receive antenatal care, or training those in the community to know how to deliver antenatal care. And, like the World Health has said that, that we should have at least 4, or these women should please have at least 4 visits to the doctor in their early pregnancy, in the second trimester, and 2 in the third trimester. Now, I'm going to just put my line here and says that's for the rural areas where access is limited. This is not a message to those who are in places where they can access healthcare and say, you know what, they said 4, so I'm going to go for 4. There are good reasons why we have the number we have of visits that you should attend. But in those places where there's limited access, if they can make it to the facility 4 times in their 40 weeks or 10-month pregnancy, then at least we know we'll be able to catch the things we need to catch before they become a problem in the pregnancy. So these are the ways I think we need to address it, and again, education is key.
Okay. What about during the process of childbirth itself?
One of the key things there is, no matter how, most of the time we go to community and we talk about access to health facilities, we realize that, they're not going to leave these traditional birth attendants and the community health workers are there for a purpose to try and